You combine that with the fact that there's just a fundamental lack of trust with many public health officials. And in my opinion, I could be way off base here, and the people that have low trust in public health officials are welcome to tell me where they believe I'm wrong. And please do tell me in the comments where you believe I'm wrong if you're someone who doesn't have trust in public health officials, because I don't speak for you. I'm just trying to tie into your head. I think the reason that they lack a sense of trust is because it feels like they're talking down to you. And it feels like they're telling you what you need to value. They're not allowing you to make a multivariate analysis, taking every single factor into approach when you make your own decisions. They're pretending that there is only one factor, and we are going to focus on this one particular variable at the expense of everything else. Lower cases, lower cases, lower the case number. I got both of my doses of the Moderna vaccine, and I had a lot of people in my comments saying, "Oh my God, you can't get the vaccine, it'll kill you! A terrible spike protein!" Hey everybody, how's it going? So today I thought I would read you an article that I was really hoping would not feature the L word. I thought that we were done with the L word after last year, but it doesn't look like we are. So this says, WHO expert, Delta variant poses stark choice between behavior change or more lockdowns. The growing spread of the COVID-19 Delta variant is creating an increasingly stark choice that could make the difference between more reopenings or a return to restrictions that decimated the world's economy, a World Health Organization expert suggested on Friday. Amid the leak of internal documents from the U.S. Centers for Disease Control and Prevention, comparing the transmissibility of Delta variant to that of chickenpox, new discoveries are sparking furious debate over how vulnerable the vaccinated could be to transmitting COVID-19, should they get it. It also highlighted the struggles of public health officials to boost the mass vaccination effort and encourage the voluntary use of masks in public. Dr. Bruce Aylward, a senior advisor to the World Health Organization's Director General, suggested that Delta spread is posing a challenge to relaxing restrictions that are feeding a rise in infections. More transmissible means more cases, more sick people, more hospitalizations, more ICUs filling up, he said. Aylward was responding to a question from Yahoo Finance on how to best communicate the seriousness of the virus to the public. Which brings us to a choice. Do we do more stuff to stop it at an individual level, or do we have to go to more lockdowns to stop it? He added. I could answer this here. So the reason that the public is choosing not to take what you're saying seriously is because they believe that when you say what you're saying it with the idea that you have the ability or the choice to limit people's freedom. And anytime you use something as a reason to limit people's freedom, their brain is naturally going to lean towards wanting to ignore you, even if they actually think what you're saying may make some sense, because they don't want their freedom limited. So the way that you're proposing it, the way that you propose the statement, in and of itself is part of the reason that you're not able to communicate the seriousness of this to the public. Yet Dr. Mike Ryan, executive director of the WHO Health Emergencies Program, pushed back against the idea of a communication failure. We've been speaking about this for months now. The dangers have been raised time and time again, Ryan said. Yes, they have been, but again, you haven't been able to get buy-in from the public. And this is something that I went over in a recent comment in a recent video where I said that virtually everybody is a salesperson. Everybody who's communicating with the public in any way is a salesperson. They would highly benefit from reading this book from Jim Camp called Start With No. Everything is a negotiation. You're always in a process of a negotiation, and you need to understand the pain point of the individuals that you're speaking to, and you need to be on the same wavelength as them. It's an excellent book. It really did change the way that I dealt with my customers, my staff, and people in general, and I really wish I could have got the chance to meet Jim Camp in person. Unfortunately, he did pass away a few years ago, as I read just recently. The frustration was mirrored by Ben Wakana, the White House COVID-19 response team's communications director, in a series of tweets on Friday. He highlighted the numerous times the CDC and other agencies sounded the alarm on the variant, which is now spreading rapidly across the U.S. CDC has sounded the alarm on the danger of Delta for months. They've called it hypertransmissible, significantly more transmissible, much more transmissible, one of the most infectious respiratory viruses we know of and that I've seen in my 20-year career. And yes, let's say this is all true. Well, what are you going to do about it? Well, what you could do is you could get vaccinated, in which case the chance of you, if you don't have a pre-existing condition, of actually dying of it or having serious, horrible side effects as a result of getting it are really slim to none, looking at the numbers of it. Or B, you could decide to go into a lockdown mode, which again, most people, they want to get on with their lives. It's been like 16, 17 months now. A lot of people are looking at this and going, okay, listen, everything you're saying, listen, I believe you. Okay, let's say that is the case. What they're doing is they're not ignoring you. What they're doing is they're making their own risk assessments based on the available data, based on the number of deaths, based on the number of people who've had adverse effects, based on the numbers after you get the vaccine. And what they're saying is, I'm going to get on with my life. you have people that are saying, okay, you know what, I'll stay inside, won't go out, won't do any of that stuff. And then you're having people that are saying, I'll get on with my life. Doesn't mean that they are not listening to you. It doesn't even mean that they don't necessarily believe you. It just means that they're making their own risk-reward calculations for the risk of this happening versus the downside if they were to continue to live their life with a considerably lower standard of quality as a result of even considering a lockdown measure in July to August of 2021. This new CDC data, reported by the Washington Post and other publications, was mostly known to health experts. However, the comparison in chickenpox has put a finer point on the dangers of the variant. How they release this information and how it's communicated, that seems to continue to be a place for improvement for the CDC, says Dr. Anand Parekh, Chief Medical Advisor at the Bipartisan Policy Center. Parekh, a former U.S. Health and Human Services Department official, said using words like highly and hypertransmissible is how he even presents information when speaking to the media. But as a health expert, hearing chickenpox gives greater clarity, since that virus can easily infect 8 or 9 other people, which is a huge jump from the original strain of the coronavirus, which was believed to spread to 2 other people for every 1 person infected, Parekh said. Now, when they're talking about greater clarity and why are people not worried and how is it that we are not getting it across to people, I think a big part of the reason for that is because, let's say use the word chickenpox. Every person that I've known or met in my life got chickenpox when they were very young. Every person that got chickenpox spent a week off from school scratching the crap out of themselves, and every person that I know that got chickenpox is still here. So this may be part of the reason that when you use those words and then you use lockdown in the same paragraph, I get the point you're trying to get across, but you have to also understand why people are saying, okay, I got it, I got vaccinated, it's been a year. All right, okay, cool, chickenpox, getting on with life. WHO's Ryan said the rapidly evolving virus is creating a communications challenge as well as steepening the learning curve for everyone. In some sense, we're all in kindergarten when it comes to this virus. We're still learning, Ryan said. We're to be taking baby steps in trying to control the virus, he added, noting gaps in the response between high and low-income countries has fueled the deadly impact of the virus. There's no magic dust. People keep asking for magic dust, but it doesn't exist, he added. Dr. Howard Foreman, a health policy and management professor at Yale, told Yahoo Finance that even with the headlines Friday, the information is all in an echo chamber. That's the hard part. How do you get through to people who are not understanding this? He asked, calling for better information dissemination. And again, at the end of the day, the issue is not people are not understanding it. It's not that you need better information dissemination. It's that people have the information, but are making their own choices. And those choices are different than the choices that you would make. They're looking at the information and they're taking into account and they're making their own risk assessments. So this is something that gets updated fairly regularly from New York City. This is from NYC Health, not some random crazy third-party source, not Reddit r/conspiracy. This is New York City Health coronavirus data. And for people that do not have a pre-existing condition, who are in the age group of 25 to 34, we have 5 deaths. 5. I understand. I'm looking at the same information that you're looking at. I'm making a different decision than the decision that you would make. It's not about not understanding it. It's not about not getting the data. I got my vaccine. I spent a year and a half wearing masks, indoors, outdoors. I limited my activity for a year and a half. And then I got to the point where I saw the L word being used in the news. And it's like, nah, it's a year and a half in. I got it. I got vaccinated. Going on my life. I have a risk. I'm making my personal risk assessment based on my actions, based on what I've done, and based on the data. And that data is data that makes me likely feel a little bit more calm than, let's say, the individuals involved in this article when it comes to my life and my future. And I am looking at the risk of what my life will be like if I say I am going to continue to put it off each time a new variant comes out for an undetermined period of time versus getting on with my life with the risk that as a vaccinated person that already survived COVID, that something's going to happen. And it's like, continuing. The story is when we first had a vaccine, we thought it would be protective against the disease, and we hoped it would be protective against infection without symptoms. Each of those ideas keeps falling apart, Foreman said. However, data suggests the vaccines do protect against death. Meanwhile, the surge in Delta variant hospitalizations has disproportionately impacted the unvaccinated. Okay, this over here. That story is falling apart. These ideas keep falling apart, right? We thought when we first had a vaccine it would be protective. Data suggests it does protect against death. And for a lot of people that got the vaccine, what they're looking at is, okay, so you're saying that I may still get this. I'm still going to get COVID with this new variant, but I'm not going to die. It's just going to be like, it's going to suck. It's going to be like a crappy cold or something like that. I'm going to have a cough. I'm going to have an aggravating sneeze or a fever. And what they're saying, I think what a lot of the people that got the vaccine are saying is, it's not about the information needing to be disseminated to all of these stupid people that just don't get it. It's about people looking at the information as it exists, realizing that many of these deaths, many of those 5 deaths, those happened before we had a vaccine, and for people in my age group that do not have a pre-existing condition, and looking at that and realizing, okay, I'll get it. I won't. You gave me a vaccine. That vaccine will lower my chance of dying from the sub percentage level that it was before to something even lower than that. All right, I'm good. That's what a lot of people are saying. Continuing on. And with concerns over Delta unlikely to subside anytime soon, Parekh said it suggests the direction we're going, and essentially, we need universal masking. Meanwhile, experts are already bracing for more mutations of the coronavirus. This will not be the last virus variant you will hear us talking about, said Dr. Maria Van Kerkhove, COVID-19 technical lead at WHO. There will be more, she said. Okay, this is the point that I think really needs to be pointed out here and that requires further discussion. This is why people are looking at it and saying, okay, it's time to get on with life. So they're saying that there's a new variant, so we should probably have a lockdown. We need a lockdown so that we can stop the spread of the new variant. However, there are going to be new variants. Okay, so once Delta's, okay, so let's say you lock down for 2 or 3 months because of Delta. Okay, now Lambda's here. Okay, now let's lock down for 2 or 3 months because of Lambda. Okay, now Lambda's done. Okay, now we have the, Mr. Clinton variant. Okay, now we're going to lock down for 6 months for the Clinton variant. Okay, we're done with that. Okay, now we're going to lock down for 8 months because of the Gamma variant. Okay, now we have now we have the Theta variant. Okay, the vaccine is good against the Theta variant, so we don't have to worry about that one. Phew. Okay, oh crap, another Zeta variant's out. The vaccine's not good against that one. It'll keep you from dying. It'll keep you from being in the hospital, but you'll still get it. Oh no, lockdown! And I think people are looking at this and just thinking, it's one thing to have one lockdown. It's one thing to have one lockdown to try and curb the spread in the beginning. But if each time a new variant comes out, if that means that my freedom then gets just blown up each time there's a new variant, that doesn't work. There's no limiting principle to that. That means that it's time to get on with life. I don't think it's an issue of people not having the information. I don't think it's an issue of them not having the information in front of you. I think it's a case of them having the information in front of them, not trusting the individuals that are talking to them, because the people who are giving them this information are completely avoiding people's own personal risk-reward tolerance for what they're willing to live with. They are focusing on this with this univariate analysis of keep cases low. We must keep cases low. Why don't they understand that this will keep cases low? Because many people in the United States, and particularly other regions of the world as well, are not just focusing on only keeping cases low. They're looking at, okay, what happens if I get COVID without a vaccine? What happens if I get COVID with a vaccine? What does this virus do to different groups of people? And above all, what is the value of enjoying my life, continuing to run a business, continuing to have a job, versus this small, teeny tiny, minuscule reduction in the chance of death in exchange for a life filled with more economic uncertainty, more depression, more anxiety, more suicides, and above all, just a never-ending potential curb on your freedom with no limiting principle. Because here's the thing. First, the idea was, well, the hospitals are going to be overrun, right? The hospitals are going to be overrun, so people should stay. Okay, fine, we'll do that. Okay, then it's, okay, there's way too many deaths. We need to get down the deaths. So, okay, fine. If the hospitals aren't overrun, but there's too many deaths, people should stay at home. Okay, fine, understand. Okay, well, now the hospitals are not overrun, and there's not too many deaths, but we need to get the case number down. All right, fine, we'll keep the case number down just until we get a vaccine. Then it's, okay, listen, the hospitals are not overrun, the deaths are lower, the cases are lower, and we have a vaccine. But we still got to be cautious, because if something comes, it's like, no. First it was 2 weeks, then it was because the hospitals were overrun, then it was too many deaths, then it was too many cases, then it was wait for a vaccine. Now it's like, you know what? There really doesn't seem to be a limiting principle here. There really doesn't seem to be something that ever going to end. And if the idea, and I asked this in somebody in my comment section, I asked them, okay, so what is the limiting principle? What is the limiting principle? If the vaccine does not stop you from getting COVID, the vaccine does not stop you from getting it, and as long as people are getting it, that means that there should be a lockdown, then when does it end? Never. Because the person responded to me and said, as long as there are cases still spreading, I would completely support a lockdown. But if the vaccine doesn't stop you from getting it, it just stops you from dying or being more ill than you would have been without it, that means there's no limiting principle there. If there's no limiting principle there, that means that we have no metric for when many people will get their freedom back, in which case people just stop caring. They just stop caring. They see the information, they see the numbers, they look at it, but then what they're doing, which a lot of the individuals in this article just don't appear to understand because they are focused on a univariate analysis, is they are weighing the chance of getting COVID, having a bad adverse effect from COVID, or dying from COVID in their particular age group and risk class with the value of limiting the freedom that they have in their life anymore. And how they're weighing it. They're doing this, and they're figuring out what they're comfortable with doing. As I've said in other videos, there is no such thing as a perfect solution. There are compromises and there are trade-offs. And you need to choose which set of compromises and trade-offs makes the most sense. When someone does a univariate analysis and seemingly just ignoring every other factor in favor of this one univariate analysis, they are not gaining credibility or trust from the public who actually have other factors to deal with. If you are a public health representative, then your primary objective, lower the number of cases, lower the number of cases, lower the number of cases. But there are many people who are also looking at their overall quality of life. And there are many variables involved in that quality of life other than the risk of getting COVID and the risk of what's going to happen after you get COVID for someone who is already vaccinated. You combine that with the fact that there's just a fundamental lack of trust with many public health officials. And in my opinion, I could be way off base here, and the people that have low trust in public health officials are welcome to tell me where they believe I'm wrong, and please do tell me in the comments where you believe I'm wrong if you're someone who doesn't have trust in public health officials, because I don't speak for you. I'm just trying to tie into your head. I think the reason that they lack a sense of trust is because it feels like they're talking down to you, and it feels like they're telling you what you need to value. They're not allowing you to make a multivariate analysis, taking every single factor into approach when you make your own decisions. They're pretending that there is only one factor, and we are going to focus on this one particular variable at the expense of everything else. Lower cases, lower the case number ahead of everything else, ahead of just... that is important over the economy. That's important over people's mental health. That's important over crime. That's important over every other metric of happiness or success for a country or a people. Lower cases. And other people out there are like, you know what? I hear what you're saying, but I have a multivariate analysis. You have a univariate analysis. They're not ignoring the scientists. They're not ignoring the doctors. They're not ignoring the medical professionals. They are just taking into account that the medical professionals, the scientists, the doctors, the public health officials are, for the most part, appear to be looking at it as if it is a univariate analysis. Yet people's lives involve multivariate analyses. And as long as there doesn't really seem to be a consideration of that, people are just going, oh, it's like, oh, okay, it's chickenpox? And, as I say on this channel, this is something that comes up fairly often here, and I think it's disingenuous, and it's really shitty that people will do this. Is they'll say that this is a very, very what's the word I'm looking for here? They'll say that that I am anti-mask. They'll say that I am anti-vaccine. They'll say that I am a COVID conspirator, and all these type of things. And it's like, it's so horribly disingenuous. I did this one video last year. I was telling people why I made sense to me to wear a mask during coronavirus, and this was just one of my bike videos. I talked about it for about 25 minutes, and in the description, before there was a vaccine, when the case was still spreading, I included over here about 60 plus scientific studies that explained why it may make sense to wear a mask to slow the spread, not prevent the spread, but slow your chance of giving it to somebody else. You can still get COVID if you wear a mask. It just lowers the chance of you giving it to somebody else. Why it makes sense to do that in the beginning. Included 60 scientific studies here explaining why this makes sense. I wore a mask in my office. I had a mask mandate at my business. If you didn't have a mask, you couldn't be let in. I also did this video several months ago after I got the vaccine. I got both of my doses of the Moderna vaccine, and I had a lot of people in my comments saying, oh my God, you can't get the vaccine, it'll kill you! a terrible spike protein. And, they're saying, oh, you're going to be out of shape. All these things are going to happen. Okay, so I was a little bit tongue-in-cheek, but I showed, I got about 7 deadlifts in at 300 pounds before the vaccine, and I got 7 deadlifts in at 300 pounds after the vaccine. Now I'm actually up to 9, but I'm not giving Moderna credit for that. And I was a little tongue-in-cheek because, again, deadlifts is not the only test of physical health. But, the point I was getting at here is, listen, I got the vaccine. I'm not fucking dead. I'm not, so like, cut it out with that stuff. I think it's a good thing to get the vaccine. I think it makes sense to get the vaccine. I have friends that did not get the vaccine, and I also know someone who decided that they did not want to get the vaccine, who died. Again, his personal decision. I respect his personal decision. It sucks that was his personal decision because things may have been slightly different otherwise. But again, I can't change people. There are people that often say, Louis, don't you understand the amount of influence that you have? If only you told people what to do, if only you told them to get a vaccine, that they would do it. Here is a chart of my channel's growth over the past 5 years. Here is a stock chart of Apple stock over the past 5 years. I couldn't influence my way out of a paper bag in my own field of expertise. Imagine how many people are going to take medical advice from me. I can't change what people decide to do. I can talk to them. I can try to reason with them. Can't do much. It's really weird to be in this kind of place, this like limbo here. Because usually I talk to people who think that this is all bullshit, COVID's all fake, blah, blah, blah. Or I speak to people who are like, yeah, no, it's real. How dare you? You should be encouraging people to stay indoors. Lockdowns are good, blah, blah, blah. Don't you not want grandma to die? There really is this kind of middle ground here. People just take into account do a multivariate analysis. They look at the numbers. They think about what they want their life to look like over the next 10 to 30 years. They think about where their life's going to go if we accept the idea of lockdowns that lack a limiting principle, where the limiting principle is we want to lower cases, but vaccines can't lower cases. There are going to be new variants. There are always going to be new variants, as they said. And if cases go too high, you must consider a lockdown. And they're looking at it and going, well, gee, I don't see a way out of that. So that means that you're going to limit me for the rest of my life. I'm going to opt out of that and say no. Maybe I would opt into it if this were Ebola, but for COVID, looking at the numbers, no. And then these public health officials look at it and go, wow, I can't believe that people are not listening to me. I keep telling them that there's this thing with no limiting principle that is going to continue to limit their freedom, and they don't seem to want to listen to what I have to say. Why is that? Gee, I wonder. And let the bomb of a comment section begin. That's it for today, and as always, I hope you learned something. Let me know what you think down below. Feel free to say whatever you'd like down below. You can say that you agree with me. You can say you disagree with me. You can explain whether you agree with this article, disagree with this article, why you think that people don't have trust for our public health officials. Do you think it makes sense to not trust or trust our public health officials? Do you think it makes sense or does not make sense to get a vaccine? Do you think it's being an asshole or not being an asshole when people say that I am anti-vaccine, in spite of the fact that I've done videos literally saying that I got a fucking vaccine and demonstrating me exercising after the fact just to, fuck off the anti-vax conspirators that were saying that I was going to be horribly out of shape and dead or not able to work out afterwards. I was loving that because there was this one workout video I did on the live channel a while ago, and somebody said, "Now, yeah, he can't do this now that he got the vaccine." And I'm like, "Oh yeah, mofo? Okay, cool, game. Let's do that." So that's what inspired this video. There was like that one comment. It was like, I can't tell if it was a troll or real. That's the thing about some of these comments now. I actually can't tell which ones are like trolling the fuck out of me and which ones are people who actually believe what they're saying. It's difficult to tell, but yeah, anyway. Let me know what you think down below. I'll include a link to this article. I'll include a link to these 2 videos that I did just for all those straw man mofos that say that I'm anti-vax or anti-mask, and I will include a link to all of those studies in that video so that people can tear them apart and get mad at me over them. I'll see you in the next video. Bye now. Mr. Clinton ran away because he just wants to be pet at this point. I got to pet my cat.